The question I focused on was to meaningfully address the nurse shortage, policy initiative must take a multi pronged approach addressing the need to expand the workforce, increase diversity among nurses, and retain experienced nurses. What steps can be instituted at the management level to address one or more of these goals? Can you identify any larger policy issues behind your own organization that may address issues related to the workforce? Um, Increasing salary based on education and experience, better compensation. If nurses were paid based on education in their facility, it would motivate nurses to further their education from an RN to a BSN. This is important because the U.S. Institute of Medicine recommends that 80% of the nurses in the workforce have their BSN. As a staff nurse, I think one of the things that would improve the retainment and hiring of nurses is to if the base salary on both education and experience. I think facilities that have long-term nurses should be pay incentives to nurses who have been at facilities 5 or more years, 10 or more years, and then so on based on their years experience at that facility. I also think that there be a salary increase for nurses with their BSN. Some facilities pay an increase due to education, but not all. I feel it was something. I feel it would be something that was across the board. It would help for nurse retainment, but would also influence the nurses that do have an LPN or an RN to strive for their BSN. And again, this is something that the U.S. institution it wants to see effective and are pushing that 80% of the nurses in the workforce do have that BSN. Also, I feel that they should have some education incentives for current nurses. That would also help to improve nurses' retention. I know that there are facilities that will pay a percentage of class credits for nurses seeking continuing education, but not all facilities do that. And some of the facilities will pay after you've achieved a grade of a B or above. Some will pay before that. So I think that, if we were on the same page in facilities, that would absolutely make a difference as far as retention goes. Improvements in nursing management, I also believe, is important. One of the significant ways to increase nursing retention is to be improving the relationship between the nurse and nurse managers. Improving support from nurse managers and increasing trust between staff and nurse managers would help to improve nursing satisfaction, which would lead to higher retainment of nurses. And nurse managers and staff communication will help strengthen these relationships to move towards this goal. What can an organization do to improve nurse staffing? As a whole, these could be policy improvements in nursing created by the government to aid in the overall retainment and increase in nurses. Creating requirements and laws to protect nurses would also help. There have been so many reports of nurses getting injured on jobs, especially as of recently. So hearing this might influence people to stay away from the nursing field. However, if there were laws protecting nurses, that would help more nurses feel safe and secure in their field. Strong leadership and communication is a quality that needs to be a part of these facilities. Without good communication, there will always be a lack of success at any facility. Safe nurses to patient ratio is another important policy that should be put into place and help nurses know that they are protected. Having too many patients can lead to nurses feeling overwhelmed and is a safety concern. No nurse wants to risk their license because organizations are pushing for nurses to have more patients than a nurse feels safe having. And this is why a policy to institute safe ratios should be put in place. No nurse should have to feel that their patient is at risk because the organization is possibly putting financial gain over safety. And these are my references. Thank you.